Hello and welcome to Mississippi Insight. I'm Byron Brown. Thank you for joining us. This week, Mississippi is struggling to provide adequate mental health services to people in need. The state insists otherwise. Meantime, some patients are waiting in jail cells because they can't get a bed in a community mental health center. Isabelle Taft from MississippiToday.org shares her reporting on the mental health quandary. Also, 2 years into the COVID-19 pandemic, is our state ready or not for the next public health emergency? Dr. Nadine Gracia details a new report by the Trust for America's Health this Sunday on Mississippi Insight. The state of Mississippi has some big problems with its mental health network, and the federal government is pushing for substantial upgrades. A new report from a federal monitor appointed by U.S. District Judge Carlton Reeves paints an incomplete picture of the state's capacity to support mental health and treat patients. But some of what that monitor found is clear and troubling. Our next guest has reviewed that report. Isabelle Taft is a reporter with the community health team at MississippiToday.org. She joins us by Zoom. Isabelle Taft, welcome to Mississippi Insight.
Thank you for having me. Glad to be here.
This compliance report by Monitor Michael Hogan was filed with the court on Friday the 4th, and one of the things that he focused on was civil commitment cases. Explain what civil commitment is and how it's impacting some Mississippians in need of mental health treatment.
Yeah, civil commitment is really meant to be kind of a last resort when someone is in such a serious mental health crisis that a loved one believes they pose a danger to themselves or to another person, or that they're at risk of spiraling if they don't get immediate treatment. A relative, a loved one, can go to a local chancery court and ask for their loved one to be hospitalized involuntarily. And this process is supposed to result in the person pretty quickly getting treatment at a state hospital. But what Dr. Hogan documented is that in many counties in Mississippi, when a bed is not immediately available at the state hospital or at a crisis stabilization unit, the county sends the person to jail. And counties by law have to pay for the person to be kind of cared for during this period. But the law allows them to send people to jail to wait for hospital beds. And experts are in agreement that that is not the right place for someone with severe mental illness to be. They need to be getting treatment. That's not happening immediately in Mississippi. And when they do go to the hospital eventually for treatment, Dr. Hogan's report also documented some troubling trends there, where it's not clear that everyone who gets committed actually has a serious mental illness. He documented cases where people had diagnoses like dementia, and yet they were committed. And that sort of suggests that perhaps local authorities don't understand the process as well as they ought to, and that could be having really devastating consequences for Mississippians who are forced into this process against their will.
You found that the feds are still awaiting some critical data from state authorities. He told the court he has only an incomplete picture of how state mental health services are complying with Judge Reeves' remedial plan for improvements. What data are we talking about here?
Yeah, the next report should include more of that. Dr. Hogan is supposed to file these every 6 months. Under the remedial plan, the state is supposed to collect a whole lot of data by the end of fiscal year 2022. So that's going to be at the end of June. And this is going to include a much more complete picture of commitments. So in each county, each region of the state, how many people are getting committed, where are they being held before being admitted to the state hospital. It's also going to include data on who exactly is using all of the community services that the state has started trying to roll out and really has tried to invest in. And it's going to include information on calls to the mobile crisis response teams, which are also a kind of newer element in the state. And that'll tell us how long do these teams take to get to the crisis, what is the outcome when they do respond. And the data at that point, I think, will paint a much clearer picture of how much are community services actually being used in Mississippi at this point, who is using them, and are those services resulting in people avoiding hospitalization?
You've also written this month about how the state attorney general's office essentially ordered our community mental health centers to stop communicating directly with the U.S. Department of Justice. What is going on there, and how big is an issue is this in the state's legal tussle over the federal remediation plan?
I think that is a little bit unclear at this point, because the state did say to DOJ, you can't communicate with the community mental health centers except through their attorneys, because their testimony, whatever they say, could be seen to be kind of speaking for the state. So in a certain way, the state is arguing that they're an extension of the state, and that thus they shouldn't be allowed to talk to DOJ. But it doesn't appear that has resulted in any denial of access to Dr. Hogan, who's independent, separate from the Department of Justice. In his first report that came out in early March, he wrote that he had been able to visit 6 of the community mental health centers. He reviewed patient records. So the fact that the community mental health centers are not communicating directly with DOJ at this point, and Judge Reeves may rule that the state was wrong to try to prevent that communication. But in any case, Dr. Hogan does seem to have a window into their activities, regardless of what the community mental health centers are allowed to say to the Department of Justice.
And what is next in terms of court action and the state's appeal to the Fifth Circuit?
So the deadline for the Department of Justice to respond to the state's appeal is today, actually. I haven't had a chance to look at it, but it'll be interesting to see what the federal government says and whether the court, what the court decides to do next. And the state, of course, has argued that their remedial plan and the appointment of Dr. Hogan constitutes I think they called it perpetual federal oversight of the state's mental health system, and they don't want to have to deal with that at all. So we're going to wait and see what the DOJ responded today, and it'll be interesting to see what happens next in that process.
Yeah. Why do you think that the state is falling short when it comes to mental health? Is it staffing? Is it funding? Is it all the above? What's going on here?
Gosh, that's a great question. There's a lot of different factors. Staffing, especially since the pandemic, has been a big issue. Earlier this year, I reported that since the pandemic began, the Department of Mental Health has lost about 1/6 of its total staff. And that's just in the last 2 years. So that means that they're able to staff fewer hospital beds than they were before. But this problem is really longstanding. The Department of Justice had actually notified Mississippi that it was concerned about the mental health system back in 2011. And so there's an element of kind of the system having become outdated because it relied on institutionalization, which at one point was much more common across the United States. And because of lack of resources, lack of staffing, never really caught up with other states in our country.
Isabel Taft, thank you for your reporting and your information. Thank you very much for joining us.
Thank you. Glad to be here.
Coming up, a mixed bag for Mississippi and a fresh review of state's readiness for a public health crisis. It's Mississippi Insight only on WJTV. We are 2 years into the COVID-19 pandemic, and certainly our daily reports of new infections are far lower than they were just a couple of months ago. But people are still dying from COVID in Mississippi at high levels. Now we need to ask ourselves, are we as well prepared for a new pandemic or some other public health emergency? Our next guest is someone who's trying to answer that question state by state. Dr. Nadine Gracia is the president and CEO of Trust for America's Health. It's a nonprofit, nonpartisan public health advocacy group, and they are just released their Ready or Not report on public health emergency preparedness. Dr. Gracia, welcome to Mississippi Insight.
Thank you so much. It's a pleasure to be with you.
First off, how did your organization evaluate preparedness in this new report?
Well, the Ready or Not report is our annual assessment of states' level of preparedness to protect residents' health during an emergency. And that emergency can be an infectious disease outbreak, but can also be other sources of emergencies, such as weather-related events like tornadoes or flooding and hurricanes. What this report does is it provides really actionable data as well as policy recommendations to help public health officials, as well as state and local policymakers and lawmakers to be able to impact and develop policies and programs that will improve their jurisdiction's emergency preparedness. We base this report on 10 performance indicators and then categorize the states in 3 performance categories: high, middle, and low. And those performance indicators really are relevant to emergency preparedness. They're factors like being able to expand your healthcare capacity and supporting staffing needs during an emergency, or being able to expand your laboratory capacity if you have to surge the ability of your laboratory during the emergency or crisis, as well as looking at factors such as accreditation in public health and emergency management to provide quality services during an emergency.
And so, Doctor, what did you find out about Mississippi's readiness for a public health crisis?
Well, in this year's report, Mississippi was placed in the middle performance tier. What we saw, certainly with the state of Mississippi, when we look at areas of strength, are one, that the state has a plan to be able to expand its healthcare capacity if there is an emergency, by having a plan where for available nurses that can cross jurisdictions coming from other states to be able to support staffing needs in the state of Mississippi. The state also has that plan in as far as laboratory surge capacity to be able to provide increased laboratory services in the height of an emergency. The state as well has accreditation both in public health and emergency management. But where there are opportunities for improvement for the state are areas such as public health funding. We saw a decline in state public health funding. And this is really an important issue, not only at the state level, but nationally. The public health system has long been chronically underfunded. We've seen declines over the years, and that has significant impacts, whether it's in the public health workforce or the ability to be able to do all of the core foundational capabilities of public health, which includes that disease surveillance, communications, and policy development. So seeing that type of decline is really important to address so that we can ensure that we're investing in public health and prevention. We also saw with regards to other metrics are things like patient safety and looking at hospital quality and the percentage of hospitals that had an A grade, if you will, with regards to their patient safety metrics. And we saw that being low, not only in the state of Mississippi, but around the country. And again, an area and opportunity for improvement.
Doctor, talk about the factor of health equity in communities that experience a disproportionate impact during such emergencies.
Yes, absolutely. You know, we have seen, certainly in the context of the COVID-19 pandemic, how it has exposed and even exacerbated health inequities that have long existed in our nation and in far too many communities, where we understand it's one, inequitable access to health care and having clinics and hospitals and doctors' offices available in communities in need, but also looking at other factors like the social and economic factors, for example, food security, having access to transportation, affordable and safe housing, to employment, how those factors were so vital and critical to address in the context of the pandemic. And yet we have seen this in public health emergencies in the past. So some of the lessons learned from this pandemic is for us to truly invest in addressing these broader social and economic conditions to ensure that all communities have the opportunity to be healthy and to be resilient, certainly in the context of an emergency.
And what sort of recommendation do you have for federal and state policies to improve public health preparedness?
Well, importantly, we can learn the lessons of the need to invest in prevention and public health. What we are seeing within the context of the COVID-19 pandemic, but also with other public health emergencies, are the staffing shortages that public health has experienced, the ability to have the capacity to address more than one emergency that may be existing at the same time, as well as the day-to-day needs of maternal and child health, infection control, and chronic disease prevention. We have to really commit to dedicating investing in sustained, increased, and flexible public health funding so that we can promote health and well-being. We also have to prioritize equity in our preparedness to ensure that communities that often are disproportionately at risk, such as older adults, individuals with disabilities, communities of color, certain immigrant communities, and low-income communities, again, have the resources and the conditions that actually promote health and well-being, and that we assure that as we prepare our emergency plans, that it takes those needs into account. Addressing those broader social and economic conditions will only help to create stronger and more resilient communities.
And what sort of recommendations do you have for federal and state policies to improve that public health preparedness?
So some of the policies that we recommend certainly are, one, the investment in funding and long-term sustained funding We found that in particular, there's a $4.5 billion annual shortfall with regards to the funding that is needed for public health to meet the basic public health services and core foundational public health services for all communities. Only about half of the U.S. is actually served by a comprehensive public health system. We also recommend the importance of having paid time off policies, such as paid sick leave policies. We have seen through the pandemic that there are workers, in particular, for example, low-income workers and workers of color, who disproportionately didn't have access to paid sick leave. That's critically important to be able to have paid sick leave so that you can stay home if you're ill, and to also be able to help control an infectious disease outbreak. We also need to invest in policies that will help support the social and economic conditions, such as housing policy that provides access to affordable and safe housing, quality education that we know is tied to health and provides greater opportunity for economic opportunity in the future. We need to assure that we're also working in partnership with communities. And that's another recommendation, is assuring that community organizations, faith-based organizations, and others who are trusted in communities are truly partners in emergency planning, preparedness, and response.
It is obviously important to be able to trust authorities in public health in the time of crisis. Are you concerned that our traditional health authorities have suffered in terms of credibility with the general public amid the COVID crisis?
So indeed, there have been challenges. We have seen really attacks on public health with regards to the guidance and trying to understand when really what public health is doing is utilizing the science to drive and inform decisions that are being made to protect the public's health. That is public health's charge, is to guide and advise elected and appointed officials on the appropriate policies and programs that will truly protect and promote the public's health, both in emergency as well as non-emergency times. And when you have a new virus, for example, such as what we've seen within the context of the COVID-19 pandemic arise, it's critically important that we have the science and evidence truly drive that decision making. These types of authorities for public health are they're designed really to help support the needs for community. And when we have challenges such as the inability of public health leaders to be able to implement that guidance, or when there is misinformation, we've seen how much misinformation exists. It's important to have trusted messengers providing credible information that can really help communities during and through a pandemic or any public health emergency to be able to not only respond to, but recover well from those types of emergencies.
Your group has also expressed concerns about the inequities of climate change. What do people need to know about how climate change might impact our health?
Absolutely. Well, the scientific community really has a consensus around this, that climate change indeed is causing and leading to more serious and severe, as well as more frequent and intense emergencies, such as tornadoes and other weather events, such as hurricanes and flooding and record heat. And how that impacts health is that when you have those types of extreme weather-related events, they can impact, for example, air quality. They can also impact water quality, and you'll see poor health outcomes. For example, worsening rates of asthma or heart disease, other lung diseases, as well as if water quality is impacted, the ability to have access to safe and clean water. So addressing climate change and weather-related emergencies is part of what we describe as this all hazards preparedness when we talk about public health emergencies. Again, that it can be an infectious disease outbreak, such as what we have been experiencing over these past 2 years with the COVID-19 pandemic, but it can also be impacts such as weather-related events that are associated with climate change, to also areas even, for example, in bioterrorism. And so by investing in emergency preparedness, what we have a better understanding of is how to assure that we have the foundation to be prepared for, to detect and be able to do the surveillance that's necessary, and then to be able to implement programs and policies that are going to best protect our community's health and our nation's health security.
And Doctor, real quickly, who do you hope that sees this report, and who do you want to respond to this report? Is it just our public officials, or do you want the public at large to know what's going on here?
Well, these recommendations and the data that are in these recommendations absolutely give public health officials as well as lawmakers at all levels, federal, state, and local, and other policymakers, really actionable data and recommendations to be able to improve their jurisdictions emergency preparedness. And we also know informing the public about this is an important way as well for them to understand the importance of the investment in public health and emergency preparedness. This is critically an issue that not only involves public health or our public sector, but it also involves employers as well as others in other sectors to be able to address how we can strengthen the resilience of our communities. When you look at policies such as one of our indicators, which is on paid time off, employers have a role to play with regards to ensuring that their workforce has access to those types of policies to be able to support being able to stay home, for example, if you're sick, if there's an infectious disease outbreak.
All right, Dr. Nadine Gracia is the president and CEO of Trust for America's Health. Thanks again for your insights.
Thank you very much.
All right, and we'll be right back. Our thanks to Dr. Nadine Gracia and Isabel Taft for joining us this week. We'll be back next weekend with more of the political and current affairs coverage that you demand. I'm Byron Brown. From all of us here at 12 News, make it a great weekend.